My name is Jamie and I'm a nursing student, and today I'm going to be demonstrating a central line dressing change while using my general principles and safety practices and following my 11 medication rights and 3 safety checks as necessary. So I've already knocked and introduced myself to the patient and provided privacy. I've identified my patient with their 2 patient identifiers. I've assessed them for any pain or allergies, and I've explained the procedure and why we are doing it. So I'm going to start off by making sure the patient and I both have a mask during the procedure. I'm going to make sure to apply or do my hand hygiene and put on my clean gloves. When I have my clean gloves on, I would use a push-pull method to remove the old dressing. She doesn't have one on right now, but I would stabilize the central line and I would do the push-pull method and take the dressing off. And then with the old dressing off, I would want to assess the site for any redness, irritation, signs of infection. But right now the site looks good, well kept. So I'm going to go ahead and take off my old gloves. And we're going to perform hand hygiene again. I'm going to set up my sterile field. So now that we are sterile, I'm going to want to take my alcohol swab, I'll crack it and shake it. And I'm going to want to start at the site of the incision and go in a circular motion going outward. You're going to want to scrub it really good for about 30 seconds. Let it air dry. And then you're going to want to put on your clean dress or sterile dressing. Just making sure I had the right side up. And once the dressing is on, you're no longer sterile. I would want to take an extra piece of tape or a label and initial, time, and date that dressing, as well as make sure it's down really good and everything's secure. So now I'm going to go ahead and take my normal saline and attach it to my non-needleless connector. You're going to want to prime it. and place it back in the package until we're ready for it. So I'm going to take an alcohol wipe. I'm going to pick one of these lumens to change caps on and clean. It is clamped right now, so I'm going to take my alcohol swab and I'm going to clean all of this around. So I'm going to start at the tip and just scrub vigorously, make sure everything's good and clean. I'm going to let that air dry as well. I'm going to unclamp the line so I can attach my saline, my needles connector. And you're going to want to aspirate and watch for blood return. And if you get positive blood return, you're going to start flushing in a pulsing motion. Okay, so since this lumen didn't already have a needleless connector on it, I'm going to go ahead and leave that one on. And I'm going to take another alcohol swab and I'm going to want to clean off the hub, scrub it down, and I'm going to now get my clean cap and apply a new clean cap to it. I'm going to want to make sure I clamp the line back, and I'm going to want to assess my patient to make sure that there was no adverse reactions, any irritations, or any complications that arose during the procedure. Once that is all good, I will make sure that my patient's comfortable, they have their call light, provide them some privacy, and exit the room to report and record.